Welcome to Unmasked, the CCI Anesthesia podcast, the show where we dive deep into the world of anesthesia practice improvement, quality enhancement, and the evolving landscape of healthcare. I'm Kieran Zumwalt, your guide on this journey, as we explore the strategies, innovations, and stories that shape the future of anesthesia care. For many anesthesiologists and CRNAs, balancing a demanding career with personal time can feel like a constant challenge. Long hours, high-stress environments, and the pressure to deliver the best possible care can leave little room for anything else. But achieving balance isn't just a luxury. It's essential for your well-being, longevity in the profession, and personal fulfillment. Whether you're just starting your career or you're a seasoned professional, you'll leave this conversation with insights, practical tips, and maybe even a new perspective on how to balance your career and your personal life. Today, we're thrilled to have two incredible guests on our panel. Together, we'll explore how they've managed to maintain harmony between their demanding careers and their lives outside the OR, and how CCI Anesthesia's innovative approach can play a pivotal role in clinicians' personal and professional well-being. Dr. Brian Schmutzler is on our panel today. Dr. Schmutzler received his medical degree and PhD from Indiana University School of Medicine. He completed an internship at St. Vincent Hospital and Health System in Indianapolis and an anesthesia residency at Indiana University School of Medicine with a special emphasis on regional anesthesia and ambulatory anesthesia. Dr. Schmutzler is the chief anesthesiologist in Mishawaka, Indiana, and is the executive vice president of medical affairs with CCI Anesthesia. Currently, Dr. Schmutzler actively practices anesthesiology and acupuncture in Indiana and Michigan. Dr. Schmutzler, welcome back to the program.
Thanks for having me back.
We're also excited to welcome Bronson Taylor, CRNA, a seasoned healthcare leader known for his strategic vision and clinical expertise. Bronson holds a BSN from Utah Valley University and an MSN from Midwestern University, launching his career in autonomous CRNA practice in rural Indiana. He currently serves as the Chief Clinical Officer at Jeb's Anesthesia Management, overseeing operations across multiple states, and as Vice President of Clinical Affairs for CCI Anesthesia. With experience on the board of directors for the Indiana Association of Nurse Anesthetists, Bronson is dedicated to advancing rural healthcare and improving anesthesia practice nationwide. Bronson, thank you for being here.
Thanks, I'm excited.
Brian, can you briefly share your career journey and what led you to pursue a career in anesthesia?
Oh, sure. So I had always kind of liked science and medicine and thought I wanted to be a physician. And then as I kind of proceeded through college, I got really interested in research as well, and so I started doing research on pharmacology, neuropharmacology in particular. And so that led me eventually, and it's a long story and a long path, but it led me eventually to want to do chronic pain and anesthesia. I didn't end up going into chronic pain, but as I was finishing medical school, I did go into anesthesia. I thought I wanted to do pain, and then my wife said no more school after doing a medical degree and a PhD. So ended up just doing general anesthesia. Didn't do a fellowship or anything, but did focus on acute pain management. So spent the first part of my anesthesia career in private practice, which I'm sure we'll talk about a little bit later, but it was pretty grueling being on call all the time. And in 2018 transitioned to my time with CCI, and like I said, we'll probably talk about some of that later.
Absolutely. And Bronson, what drew you to becoming a CRNA, and how has your career evolved since you started?
So like Brian, I was interested in science. At the high school I went to, they had anatomy and physiology classes, sports medicine classes, and they had this really cool internship program. So my whole senior year, I was in the hospital following respiratory therapists, and then I went to the OR. And of course, anybody who's been in the OR is a student, you go sit by anesthesia. And it was an all CRNA practice at the hospital I was at. Started talking to them, I was like, man, this is really cool. And over the next couple months, really liked it. And I was like, this is what I want to do. So when I graduated, got into nursing school, dibbled a little bit, possibly going into informatics, but I'm glad I didn't go that path. I like interaction with patients. And so went to CRNA school and came out of school, moved to Indiana, worked in a great practice for 4 years, and then transitioned more rural. I work at a critical access hospital in Bremen, Indiana. 2 anesthesia providers, 1 person every week, and have really enjoyed it. Have gotten more involved politically as well as I've grown in my career, which is a whole nother subject. So.
And Brian, in such a high demand field, what are the biggest challenges for anesthesiologists and Bronson CRNAs as well to maintain a work-life balance?
Yeah, I think particularly post-COVID, there's a lot of surgeries, a lot of sites of service, and just not enough of us in terms of anesthesia. So we're always getting pulled a bunch of different directions, trying to do more and more, not only in our own practices, but then going out into new practices, whether that's getting called by a locums company or your particular practice takes over another facility or is asked to increase service lines at a particular hospital or ASC. So I think just there's so much demand and so little supply that it makes it tough, and either that means we need more people or we're all working later at night. So I think time-wise it can be tough in anesthesia. And then I also think post-COVID the patients are getting sicker and sicker as well. I think patients kind of didn't take care of themselves in that COVID time period, and so we end up, even at facilities where you may not expect a super sick patient to be, we end up doing a fairly low risk case, but on a really, really sick patient. So obviously that's just a stressful aspect as well.
Yeah, as Brian said, post-COVID, it just seems like more and more sites of service. It used to be you only did anesthesia in the ORs. Now you're starting to go into cath labs more often. You're going to interventional radiology. There's this pull, and there's only so many of us. And so at one point it's like, hey, you start staying later. That puts a lot of stress on you. And I think as well, we have an aging group of anesthesia providers. And so that puts more stress on the system. And from a CRNA perspective, we're opening more programs, but that's not fixing the problem right now. And so for the next 5 to 10 years, there's definitely going to be that stress and strain on anesthesia providers and groups.
And the older providers too. A lot of the older providers, particularly anesthesiologists, aren't taking call. So you're talking about now putting more of that call on the younger generation. And say what you will, some of the younger generation isn't so excited to take call either. So overall, it just gets tough as to who's going to take that call and who's going to stay late.
So how do you manage the emotional demands of the job while making time for personal downtime or family?
There are a lot of emotional demands with anesthesia. As Brian said, we are taking care of sicker and sicker patients, which is it's taxing emotionally on your body. Even though people think we just sit behind a drape on a chair all day, you're mentally, thinking, okay, what's going to happen next? What's going to happen next? Especially with these sick patients. And so you really have to be able to separate yourself when you walk out of the hospital. If you're not on call, you really need to separate yourself and say, I'm going home. I need to get away from this, because that's the only way that you'll be able to get away from it.
I think a couple of things that Bronson and I both do, and I know this because we do a lot of this together, working out is a big thing for both of us. Get up early, get your workout in. I think that kind of clears your mind, centers you for the day. And then we both spend a lot of time with our families when we're not working. So just, completely disconnect as much as possible from the hospital. We can't always do that because we both have leadership roles, but put the phone away for a couple hours and just spend time with the family. That's big for both of us.
Absolutely. And Brian, for clinicians early in their careers, what advice would you give about setting boundaries to protect that work-life balance?
Yeah, I would say don't do what I do, but I tend to be pretty readily available. But no, certainly making sure that when you're not at the hospital, you're not at the hospital mentally or necessarily available to the hospital if you're not on call. I think putting the phone away is a big thing because we're so accessible. Bronson and I both carrying our phones around all the time, but if you just turn it off or silence it, put it away for a little while, I think it's better for your mental health as an anesthesia provider. And the benefit of anesthesia, for the most part, you can kind of do a shift, right? You may have to do call, but you can kind of do a shift. So it's not like you've got a whole set of patients that are going to call you and ask you for a refill on a prescription or something. If you're not in that operating room and you're not on call, you can, if you're strategic about it, you can completely disconnect, which I think is something that would really help most early and mid-career and even late career providers.
Yeah, and I think if there's anything, if you're in a leadership position at a hospital, this is something I do, as I think, okay, do I need to do this right now, or can it wait? A lot of things can wait. They're not urgent, emergent situations that you think of in the OR. I think a lot of times providers don't think of, when I get into practice, there's going to be stuff that I need to do outside of the OR as well in my practice. And finding that balance is important coming out of school.
So Bronson, what are some specific strategies or habits that you've developed to help maintain your well-being while balancing work and life?
Yeah, so as Brian said, wake up early, work out. You get to a point in the morning where you're like, I should have woken up earlier because your phone's going off. So really trying to set aside time to take care of myself physically, working out, and then as well, turning the phone off or putting the phone away and focusing on your family. That's something I've tried really hard to do because as my kids get older, they see me on my phone a lot more. And so I really try to, set it down and just spend time with them. And, life's busy at the Taylor household. I've got 6 girls, and so it's nonstop. It's just organized chaos. So
I would say for both of us also, CCI has allowed us to have 26-week or, sort of half our time, half the year doing clinical work, and then half the year doing, both of us do some administrative stuff, but also, we have time off in that other 26 weeks as well. So I think for us, we're both able to kind of unplug from the clinical aspect of things. And I know we as CCI have a lot of 26-week positions that we're sort of moving to now. I think that really does help to take the time away from the OR and say these half the year, I'm just not going to be in the OR. I'm not going to be emotionally taxed by that. I'm not going to have to think about what's the next drug I'm going to give. Because as Bronson said, it is fairly stressful in the operating room itself.
And I would just add too, plan things, plan vacations, give yourself a goal to work towards so that hey, I live in Indiana, winters are horrible, so we're trying to do something in January, February just to get through it. So I have a goal of, hey, we're gonna get there, I'm gonna have a break, I can disconnect. So go have fun, you work hard.
Yep. In that same line of thinking, how can flexible scheduling or extended time off impact a clinician's ability to recharge?
Obviously, there's stresses in life as well, but I think the stress in the operating room is particularly difficult. So having those flexible schedules, I think we have, our average is probably 17 weeks off for most of our providers. So 17 weeks off, 26 weeks off, something like that gives you that time to just step away. And I advise a lot of people when they talk about it, because you can spend that time making a whole lot of money doing locums work. I recommend to people when they ask is make sure you take some of that time off, right? It can be very, especially early in your career, very, very tempting to say, ooh, I can take that 26 weeks and make a whole lot of money. Take 6, 8 weeks off, something like that, spend a little time outside of the operating room.
And it's amazing as a clinician, and Brian can attest to this, if you're out of the OR for a week or two, you walk in and you're excited to do anesthesia again. It's like riding a bike. You get back on, you get back in the groove of it, and then maybe by day 4 or 5, you're like, I need another break. So
Bronson, what role does workplace culture play in either supporting or hindering work-life balance, particularly at CCI?
I would say it's one of the cornerstones of any practice, even outside of CCI, but specific to CCI. Brian and I are on the medical affairs team, and we really push culture, teamwork culture. It's huge when it comes to a work-life balance. Things are gonna come up in your life, and unfortunately, ORs don't stop. So when you have a culture of teamwork and you have other team members that are willing to step in and help out, it goes so far. And I think not only work-life balance, but it makes you realize, hey, like I have something really good here. And, locums might look really appealing, but I have friends here, I have people that support me. And creating that culture is, I think, the most important thing. And I've been in practices where that culture isn't there, and it's bad. It's hard to want to come to work. It almost is toxic. And you see people leaving, and people are wondering why, and it's like it's right in front of your face. Like it's culture.
We both came from, I wouldn't say toxic necessarily, but difficult situations, different places, but difficult situations. And I think coming into CCI and then now in the leadership roles we're in, to be able to actually drive the culture, at least from a medical affairs perspective, I think it's critically important, just like Bronson said. If you love where you work, you're not going to leave for a little bit more money or a little bit better schedule. You actually care about your community. And that's a big thing that we do within CCI, is because we have smaller towns and contracts at community hospitals and critical access hospitals, we don't just have a bunch of providers who just come in and work for the most part. We have providers who come in and care about that community. Bronson drives around the town that he works in and everybody knows him. He gets pulled over and they're like, oh, hey, sorry. Myself, I'm in a little bit bigger town, but still a very small hospital. I know basically every nurse in the entire hospital, every tech in the entire hospital, all the administrative people, you know, from the front, the lady at the front desk to the one who enters the charges. So I think having a family-like atmosphere, which I think we really promote as a company, is critically important.
Absolutely. And how important is administrative support or leadership in enabling providers to maintain balance, and how does CCI help in that area?
Yeah, so I mean, Bronson and I again do some of the administrative stuff, but certainly as a clinician, if you're not inclined to do that, I think it's difficult to be a full-time clinician and then also do all the administrative aspects of things. And I saw that in particular when I was in private practice. We had to not only do all the anesthesia, but run the practice as well. Even though we had some kind of outside sources that we bounced things off of, and an accounting company we worked with, it's not the same as having a true management company like CCI to take away all the things that you really don't want to do as a clinician, right? I don't want to have to figure out how to do payroll and, you know, who's going to the bank to deposit the checks and all that kind of stuff, which is things I had to do in private practice. Certainly with CCI, they handle all of the business end of things, so you can just go and be a clinician.
Yeah, the support's huge, and something we really focus on is on-site leadership. I've been in practices where there's a pseudo chief, but they have no power. They have no decision-making power, and this creates an environment where you kind of just fend for yourself. And so having a management company that recognizes on-site leadership is important, and then also supporting it goes a long way in creating an environment where people want to stay and people want to work and they love what they do.
Absolutely. Bronson, how does working at CCI help anesthesia providers maintain a healthy work-life balance?
So as a medical affairs team, Brian and I have had the opportunity to travel around the country. I'm constantly talking to CRNAs within CCI, and I want to know, how is it at the hospital? Is there something that we need to change? Because we want to create that work-life balance. And so I'm fortunate that I've been given that task to figure out, hey, is there something that we can change here, and work with the operations team, work with the recruiting team to figure out, is there a different staffing model that we should be using? What does it look like? And then going back to the team and including them in that is, I think, something that's unique to CCI. And it shows to our providers that, hey, we value your input, your boots on the ground. What do you need to have a better work-life balance?
And we as a company advocate then for the providers. I mean, that's the key. There's been plenty of conversations Bronson and I have had with administrators of, hey, you can't run 7 rooms until 10 o'clock at night. It's just not going to work. Everybody's going to leave. What can we do to make this more palatable for everybody? Do we need to add a couple providers during the day to sort of offload and use that as a pop-off valve to get some of those cases done so they're not going till 10 o'clock at night? So it's that, as well as thinking up good, and in creative staffing models where you work hard when you're there, but you have lots of time off. So having CCI as an advocate in those conversations is huge, and it's a big part of what we do in medical affairs as well.
Brian, you'd mentioned the weeks off for providers. You mentioned 17 weeks, 26 weeks off per year in some roles that CCI offers. How can very balanced schedules like this impact a provider's ability to recharge?
Yeah, I think you just need time away from the operating room. I think things are getting more and more stressful, not only because patients are getting sicker, but also because there's so much paperwork and so much administrative stuff to do. Even for us as providers, just walking in, right? We still get calls saying, hey, you didn't, check the right box here, or you didn't put the right CPT code here. So some of that, adds to the burnout. And I think 17 weeks off, 26 weeks off, take at least half that time and take some time off, recharge your brain. I think that's going to increase longevity for a lot of providers all the way across their career, early career, mid-career, late career.
I think there's a trend happening with the newer generation as well. I was reading an article about, it was more specific to surgeons, but it relates to anesthesia providers, where newer surgeons coming out of residency want that work-life balance. Well, the only way to do that really is to have more time off, because as a surgeon or an anesthesia provider, we're going to be on call. We're going to be doing cases late. And so by creating opportunities to have more time off, it helps with that work-life balance and makes them feel like they're getting away from the OR. I think of some of the OBs I worked with when I first started practicing, I don't even think they went on vacation. They'd be by themselves, single practice, and they were on call every night. And I mean, it's amazing they did that for 30 plus years, but that's not the way medicine is working now. And I think CCI recognizes that, and so we're always trying to find ways to make it appealing and show that there is a work-life balance.
What are the financial benefits of those models, those 17 weeks off, 26 weeks off?
I would say from a provider perspective, you work hard and then you get some time off to go play. You know, I always say you work hard, you play hard. And so for providers, they can see, hey, I'm going to be on call a lot, but then I'm also going to have a lot of time off. And as Brian said, in this current market, there's so much work out there. I advise people, don't work the whole time you're off, but at least, you know, you can go work other places. And as a national anesthesia management company, we have contracts all over the country. So we have providers that live in Carson City, Nevada, and will travel to other sites across the country on their weeks off because they want to work. And so that also creates an internal pool of providers for us to use, and they're a known entity. And Brian and I aren't going to be concerned about them.
What are they going to do?
Yeah, what are they going to do? What are they going to say to a surgeon? You know, we know who they are, we trust them. And so that's, I envision as we grow as a company, continuing to do these types of models and being able to offer more work for providers if they want to. We'll always ask, but we won't demand.
And I think it gives you the opportunity to decide what's important to you, right? So if you've got 26 weeks off and you say, hey, I'm happy with the compensation I get for 26 weeks, I think overall we compensate very well as a company. So there are people out there who say 26 weeks, what I make, that's plenty. I'm going to take the other 26 weeks, lay on the couch, go on vacation, do whatever. Then there's people who are more motivated by financial issues, and so they'll work 20 of those other 26 weeks. It gives you just the ability to say, okay, I've got my main job, it's 26 weeks or it's 35 weeks, and I've got my main, base salary there, and then I can move on to other things, and if I want to make more money, I will, and if I don't, I get that time off. So
yeah, we have providers that are advancing their careers. They're going into pain management fellowships because we offer that time off. They can go pursue other things. There's so many things you can do with that time off.
And Bronson, for young CRNAs that are entering the field, what advice would you give them about avoiding burnout and cultivating a sustainable career?
So as an anesthesia provider, there are only so many things you can control. And you need to let go of those things that you can't control, and you need to disconnect when you go away from the hospital. You need to find something that you enjoy. I enjoy working out. I love spending time with my family, with all my girls, but I love the Jeep. And so I am always wrenching on my Jeep. Always have something that you have is that relief valve to go do something. And that really helps with that work-life balance.
And Brian, looking forward, how do you see work-life balance evolving in healthcare, particularly in anesthesia?
I think we as medical professionals have now learned how to say no, right? I feel like in the past we kind of guilted either ourselves or were guilted into always saying yes, and I think we've learned to say no now, and no, I'm not going to work 52 weeks a year. I'm going to work 26, or I'm going to work 35. And so I think just that empowerment has helped when it comes to anesthesia providers in particular, but medical professionals in general, to be able to avoid burnout some. Are we all the way there yet? No, absolutely not. I think there's a lot of pressure and a lot of burnout in the medical profession. Overall, though, I think we're moving in the right direction, and we as a company are helping with that by doing these creative models.
So Brian, if you could go back and give yourself advice at the start of your career regarding work-life balance, what would it be?
So as I mentioned, I started my career out in a private practice, and I was on call probably 20 to 25 days a month. I would not do that again. I think I gained a lot of confidence in doing that and learned a lot of things, but I don't think that it was good for my health or my mental health either. So I would say, yeah, look for, if I were talking to myself, go look for a job or a particular setup that has a little bit more balance in it, where you're not expected to do everything all the time and never say no. You know, I would love to have come out now and not 15 years ago, where there are those options. When I first came out of residency, pretty much the only option was private practice, and it was totally based on production, right? And so, you know, there's a lot of drive in private practice. I've got to do more cases. I've got to do more cases. Otherwise, I'm not going to make enough money. And I don't know that that's the way to go anymore. I think that it's very difficult to maintain that.
And Bronson, what's one personal practice or piece of advice that you think everyone in healthcare should adopt to improve their work-life balance?
I think no matter what, in some point in your career, you're going to feel burnt out, and you need to recognize that you're getting burnt out, because that starts a spiral. And then you need to start thinking, okay, what are things that I can eliminate that are causing that burnout? I think a lot of times as healthcare providers, we feel like, you know, if I don't do this, I'm letting a patient down, or I'm not, you know, somebody's going to miss a surgery. But at the end of the day, you have, especially when you're coming out of school, you have a long career. And I've seen this on social media of providers that have been out 5-10 years, and they're like, I'm burnt out, I can't do this. And they start looking at doing something completely different careers. And I think that's the wrong way to approach it. First, you should look at, okay, what's burning me out, and where's the reset button? And obviously CCI has great jobs, lots of time off, so that could be a reset button for you.
That brings us to the end of today's episode on work-life balance in anesthesia. A huge thank you to both of our panelists, Dr. Brian Schmutzler and CRNA extraordinaire Bronson Taylor, for joining us today, and thanks to our listeners for tuning in. Unmasked is brought to you by CCI Anesthesia, leaders in anesthesia services for over 20 years. Subscribe to Unmasked, the CCI Anesthesia podcast, today so you never miss an episode. For more resources and information, visit the CCI Anesthesia website at ccianesthesia.com. We look forward to having you with us next time as we continue to unveil the remarkable stories and innovations shaping the future of anesthesia care. Until then, stay curious, stay informed, stay safe, and we'll see you next time.